Welcome to the GEMS Report, brought to you by Clarion Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. I am Ted Lee, the editor-in-chief of GEMS Magazine, along with Jeff Frankel, our managing editor. We are bringing you industry leaders and subject matter experts on all things pre-hospital medicine. And today we're talking about EMS Week again, and we have a panel from ACEP and the American College of Emergency Physicians and the National Association of EMS Physicians. So as we go around the horn, just do your introductions and give us a little bit of your background in EMS.
So hello, I'm Shira Schlesinger. I'm the Director of Education and Innovation for the LA County EMS Agency. I'm also the Medical Director for the Newport Beach Fire Department, and I'm board certified in emergency medicine and EMS and disaster.
I'm Maia Dorsett. I'm an EMS physician in upstate New York in Rochester. I am the medical director of initial education program through a community college, and I do oversight of regional educational initiatives for EMS in my region as well. And I'm a member of the board for the National Association of EMS Physicians.
My name is Navin Ariyaprakai. I'm an EMS physician as well as a former and current National Registry paramedic. I am a division director, program director for Rutgers Health, RWJ Barnabas, where I teach the EMS fellowship over there, as well as working as an EMS physician, and also medical director for ambulance in New York.
Well, thank you all again for joining us. And the topic is education for EMS Week. So why is this such an important topic for us to bring up during EMS Week, and kind of where are the focuses, or where do you see from your background that this is kind of headed? So feel free to jump in and start.
Sure, I can get started. I think that's a really big question. Education means a lot of things. I think very often we think about this as far as initial education or recertification requirements, but I think fundamentally education is in every part of every single thing that we do within the world of EMS. It's part of the necessary components of how do we become a competent EMS clinician with good clinical judgment. But I think even more so, like once you're practicing, how do you keep your knowledge up to date so that you can provide the best possible care for patients? And I think it's a really exciting time in EMS education because across the country, people are actively rethinking what does education mean? What does it look like? I think we've come a long way from saying, education is I have a certain number of hours with my, my bottom in the chair, having somebody feed information to me, and using evidence on how do people learn, how do they advance their practice and develop mastery in clinical medicine to decide, what does education look like? And that's a much more active and engaging thing. And I think organizations across the country, as well as individual clinicians, are rethinking that.
Yeah, I also believe that education in the EMS world is really an indicator of how we perceive our pre-hospital personnel and our pre-hospital clinicians. Traditionally, a lot of the shift towards butts in seats, so to speak, and the passive education process was really centered within this concept of pre-hospital clinicians as technicians rather than clinicians. And now as we increasingly embrace the professionalization of our paramedics as medical clinicians operating in the pre-hospital space, we really have had as educational developers to rethink how we perceive our clinicians' interaction with the educational resources. And as Maia said, this is a really exciting time for that.
Yeah, there's a lot of good research coming out right now where we're actually looking at education and accreditation of programs and how they implement teaching to their paramedics, to their EMTs, and also looking at outcomes, attrition rates, things along those lines. How are these people performing?
Well, with COAMPs, of course, a lot of the onus has been put on programs to report those type of things, where before no one was really tracking them. It was very individualized from city to city, state to state. And, you saw programs very early on opt out, say, I wasn't going to do, we're not going to do that. So we're done with that type of education business. But it really does. And I was a program director for several years. So I remember going through the process of having to report these things out. And from the very beginning, trying to impress upon the rest of the EMS community why it was so important that these benchmarks of retention and completion rates and why they were so important. It is an ongoing thing for sure. So what kind of experience are you seeing with the rank and file providers now looking at their education in general? Because we see so many programs shifting towards kind of the associate's degree or the bachelor's degree, the community college or four-year institution, but we still have so many departments doing internal education programs as well.
I sometimes wonder if we've set up almost a false dichotomy between these two types of programs, those that are, centered within an academic institution, and those are, let's say, department specific or internal to either departments or hospitals. And I don't necessarily think they are. And I think that one of the purposes of accreditation is to really ensure that there's a steady line that we can say that we believe, regardless of where you achieve your training, that it needs to meet these criteria to ensure that for both the students engaging these studies, as well as the patients and community members that will receive care from the graduates of those programs, that we are mandating essentially a appropriate base level, entry level qualification, and that we can ensure that the programs that have trained these personnel, regardless of how they are arranged, are still meeting the same standards. Do we need to have increased reliance on our clinicians? We do. I think increasingly we are seeing more care brought out into the field and increased resources being needed in the education of the personnel providing that care. Can various types of programs provide them? I think, yeah. We see through accreditation that various types of programs can meet those standards appropriately and graduate successful paramedics.
So, and I think we've spent a lot of time talking about paramedic education, and maybe we could spend a little bit more time talking about education at the BLS level, because I think very often when we talk about EMS education, we tend to focus on the paramedic level, and there isn't accreditation at the BLS level, and accreditation is one of the things that helps bring quality. And I'm not here on a podcast to remotely make a statement about that. But I think very often, even when we think about the difference between clinician and technician, I think even though it's part of the name EMT, I think BLS clinicians are EMS clinicians who really the definition of what a clinician is that they exhibit clinical judgment, right? They don't think like if this, then that, right? They're able to assess a patient, develop a prioritized differential diagnosis, which is done actually every single day by EMTs, and then decide on a treatment plan and reassess that patient. And they recognize that medicine is complicated. Patients are undifferentiated. Sometimes weighing the risk and benefit of an intervention is a complex decision-making component. And I think one of the things that was, changed in the education standards when there was update, and there's even room for more change, is sort of putting in more of the gray of medicine. And what I mean by that is the complexities, right? things that allow you to understand that there's lots of things that we don't know. And I think that comes from integrating research into primary and continuing education. That there's factors that impact your patient's outcome that you should consider as much as you consider the treatments, like the social drivers of health that lead to their clinical presentations. There's all these things. I think the tough part about EMS education, and the reason that I think that there's worthwhile discussion around degrees, is as we put more and more in at every single level, right? And we think about professionalization as like, how do we frame it so that people are getting appropriate credit for all the work they put in so that it's recognized by other components of the healthcare system, and that language of what they've achieved. And I think degrees are part of that, right? That you get credit for this in such a way that it's sort of speaks the same language as other healthcare professions. But I think and even when we talk about initial education, like all these themes that were now infused in initial education, I think they were written into the standard, but they're not as widespread. Like I think the goal is that every EMS education program talks about research. I don't think that's a current reality. There's still effort on the recertification level or the continuing education level to make that a reality. I think, and my disclosure here is I'm on the board of the National Registry Group, but one of the initiatives is this collaboration between the National Registry and the Pre-Hospital Guidelines Consortium to develop the EMS professionals reading list that suggests, right, these are big research papers that basically every EMS clinician should be aware of. That's something that only came out a few years ago. And I think it's a recognition that everybody should be familiar with the body of knowledge that impacts the change of their clinical practice. And I think that goes to Shira's point, is the recognition, which I think is a healthy respect for, I think, this kind of miracle that's performed every single day in people's living rooms and bathrooms and ambulance. I mean, I think it's truly inspirational, the kind of care that's delivered. The question is like, how do we continue to support that?
Yeah, I find that a lot of my clinicians, even the technicians, they are asking for more. They want to know more. They want to do more for their patients. And exactly what has been echoed throughout this conversation is that, they want to understand why. They don't want to just see, oh, I'm A, B, C, now I do D. They want to be like, well, why? And by doing that, you can see going down the list, wait a minute, I'm on the wrong path. I should be on this other path and actually take good care. Or, when you're in over your head, request additional resources so that you can care for the patient directly.
So what have you guys seen with this added push? And, we always say, well, EMS started in the late 60s, early 70s. And what we're doing nowadays is leaps and bounds above, and the technology and everything that is brought to bear. But a lot of the education standards, for a long time were time-based. If you spent this much time in the classroom, you're good. And that was kind of enough. But we're still kind of holding on to that in some areas. It seems like where, well, we've always done it this way, so we like this model, even though this model might not actually be serving us very well anymore.
Change is hard.
Yes.
Right? I mean, change is hard, and I think that this is a long road we're on. It's not really possible for us to redirect this, the entire community towards embracing a fully revised structure for how we perceive our clinicians, provide their education, supervise their continuing education, and continue to advance them through their own development and the development of the field in a way that would be very different from the original structure, of emergency 1976 of the firefighter who kind of runs out and gets on the phone with the nurse back at the hospital and is told exactly what to do. We are going to be progressing past that, but it's a long road. But when I look actually at the accreditation standards, one of the things that I find most supportive of our process is the increasing focus on preceptor training. And the idea that passing on knowledge is not something that is assumed as part of your job as a paramedic, or in the future as an AEMT, and maybe one day as a BLS clinician. But it's really something that needs to be learned, that there are instructional methods and mentoring techniques that are really important for integrating knowledge for both yourself and on the part of your learner or your preceptee. And I believe that is the model that will serve us well as we move forward in education.
Well, along those lines with EMS Week and us bringing this, out into the open and kind of being celebrated, what do you think some of the messages should be from services to their employees and to the community when there are questions about local, if I'm a EMS provider locally, or I want to be one, and I'm looking and I'm like, well, there's a service that has a program, or there's a college that has a program. But then in my community, we have a community college that has an associate's degree program, and then we have a 4-year program over here with another institution. What's the messaging that we should give out, like I said, to our individual providers that work with us, and to the community as a whole about EMS and education in general?
I don't think it's about choosing one type of program or another. I think fundamentally what's really important is thinking about the culture of learning and what they cultivate. Like, I want people who know how to think critically, who value all the different calls of like what EMS actually does, because it's not what's on emergency, right? We, every once in a while we do something really sexy, but a lot of what we do is we take care of geriatric patients who have fallen with their medical complexity, and a lot of cardiac arrest and termination of resuscitation where we have to communicate effectively. We have goals of care, like all of these things that are actually the reality. And I would look at a program and say, how well is it preparing me to provide quality care to all the patients that I take care of in a compassionate manner? Because fundamentally, at the other end of it, if we think about the culture that we try and create, I think the most important message is that what EMS does every single day on every single call actually matters. It matters to like the individual who called for their help. It matters to the family or the bystanders who call for it. Like, every single thing matters. And so I think for people to be happy long term, I think about my own practice in the emergency department. I derive joy from getting people warm blankets and a turkey sandwich. Like, that is something that brings me satisfaction, because I can know that there's a guarantee every day I go to work that, I may not make all the diagnoses. I may get some things wrong. I may have people who are unhappy with me, but I have the privilege of being able to do something kind for somebody in any given day, or do something good. I think all these other calls, all the things that EMS does, like, that is actually the thing that can bring joy, like long-term in a profession where you see a lot of hard things, you work a lot of tough hours, you have like a lot of demands on your time. And so to me, it's not like, is it provided a 4-year institution or an associate's degree or things? It's the question is like, what is the culture and what are they trying to cultivate at the end? Are they trying to cultivate lifelong learners who see, I don't know, like the beauty and the value of what we do on every single call, every single day, or people who sort of think in like black and white terms of like, this is right or this is wrong? I think that's the most important thing. And to Shira's point, like, I think that's where preceptor training comes and is so important. The reason part of it is the focus is because in the end, like, whatever educational institution you're in, people learn how to operate in the field from the people who teach them to operate in the field. And so, I don't know, I think that's the great beauty, and also, like, I don't know, with great power comes great responsibility.
Yeah, looking at different programs, you want to think about, is there medical director involvement? Are you actually interacting? Some places you don't meet your medical director till you graduate or right before your final exam, which is not great. The preceptor training is huge. I mean, in our profession, we take good clinicians and then we make them managers and teachers with no necessary formal training in teaching or managing. And with that training, you can make huge differences in people's education.
And it's interesting, actually, to me that you said that we make them teachers and managers without formal training. But if you think, even as entry-level paramedics, they have to teach and manage their patients on a day-to-day basis. And I think there's a real good argument to be made for incorporating some of that education early on so that we are graduating our paramedics or our AEMTs or our EMTs with an understanding that in each interaction, they are going to be managing a situation, potentially managing a team that's working on that situation, and also educating as part of their duty to the patient and to the community, even to the point of educating on what they're doing at that moment to the patients and potentially to bystanders. And that could really inform our future.
Yeah. So as we're wrapping up today, I want to take a second again to thank you all for being part of this and bringing more attention to the Education Day for EMS Week. Just around the horn again, any last parting words of wisdom for EMS Week and EMS Education Day?
I really appreciate EMS Week every week as a week that I actually participate in EMS education by going to a conference that's specifically for EMS providers, and really hearing the thoughts on the future of EMS from them. And I find that really invigorating. I hope that we continue to see EMS Week as both a celebration and a call to action for everything that we do.
I'm going to say I just have sort of tremendous gratitude for the work that people do every single day. I think education is a small part of that, but a way that we can sort of continue to learn and grow together to bring the best possible care for patients. And I think that's a tremendous thing.
Yeah, education and continuing education is one of those things that, I mean, we've all been doing it long enough that we know that what we learned in school was not necessarily correct. And innovation has happened. And that's where you get that professional enjoyment, that you get that reward when you can see something change over time. I remember my preceptors telling me how, when they first got their first, we call it a STEMI, they called it Q-wave elevation, it's much different. I remember my preceptors telling me that what we used to do for myocardial infarction was watch the heart die and then discharge them home from the hospital. Now we have more things that we can do for them. And in EMS is evolving every single day, and we need to meet that. And education is more than just checking a box, doing 2 hours of airway, 1 hour of cardiology. No, it's going a little bit further and understanding it, and also pushing forward. And even as a teacher, even as a medical director, we need to learn too. So sometimes I have some paramedics who challenge me where they're just like, hey, I read this new article, and I'm like, crap, I didn't read that new article yet. I got to go read it. So, I mean, it's always continuing learning, and that's where you get that satisfaction, because, when you're just sitting there checking boxes to check boxes, it becomes very mundane.
Yeah. Very static instead of continuing. It's just, barely holding on to what you learned before. So again, I wanted to wish everybody a happy EMS week, and thank you very much for taking the time today to talk about EMS education.